Let's talk about your kidneys. Kidney stones. What causes kidney stones? Kidney stones form when minerals and salt in the urine become too concentrated and crystallized in the kidneys. The main causes of this are not drinking enough water. You pass urine, your urine is quite concentrated and smelly. Dehydration is the biggest cause. When you don't drink enough fluids, your urine becomes concentrated, making it easier for crystals to form. Diet factors: high salt intake, too much animal protein, high oxalate foods like spinach, nuts, chocolate. Too much of everything is not good. These consumed in large quantity can increase stone forming substances in your urine. Number 3 is family history. If kidney stones run in your family, you are at risk, higher risk. Number 4, certain medical conditions like recurrent of urinary tract infections, Gout, obesity, digestive diseases like bowel conditions that are affecting absorption of whatever you've eaten. Some medications or supplements. I'm not saying you shouldn't take vitamin supplements, but you have to be careful. Everything should be in moderation. High doses of vitamin C, calcium supplements, or certain medications can increase your risk of having kidney stones. Urinary blockage. Anything that slows urine flow can allow crystals to build up. So, what can you do to prevent crystals forming in your urine? What can you do to prevent you having all these kidney stones? Drink plenty water. Yes, water, whatever you call it, drink plenty water. Fluid is very, very important. Because when you drink a lot, your urine will not be quite concentrated, will not be dark. But when you drink enough, your urine will be like pale yellow. Pale yellow. Reduce the amount of salt you take. As I said, everything is good, but eaten or consumed in moderation. When you have salt, don't have too much salt. I know too low salt, too much salt is bad, low salt is bad. So, in moderation, balance your protein intake. Yeah, most people like a lot of meat. Most people like having meat. Instead of having meat on their main meal, they would prefer to have meat, a full bowl of meat. It is not good. Eat everything, consume everything in moderation. Follow medical advice. If you had stones before, if you have had stones before, follow your medical advice given to you by your doctor, your GP, or physician. Don't say because you want to do certain things. Be careful, because whatever you do badly will affect your system. If someone has severe side pain, blood in urine, nausea, or fever, they should seek medical help urgently. Most kidney stones are linked to dehydration and your diet. So you can make small changes to avoid you having stones, kidney stones. Small changes you make today can change things for better in your life, whereby you will not have kidney stones. Okay? Make some changes. Make some changes to avoid all these kidney stones. Because if you used to drink 1 liter of water a day, increase it. By right, you should be having at least 2 to 2.5 liters, even 3 liters. Thank you, Hetan. You should be drinking at least 2.5 to 3 liters. Unless you have heart problem. If you have heart problem, do not drink a lot. If you have kidney failure already, don't drink a lot. Continue with the restriction they've given to you. If they told you to drink 1 liter a day because of your kidney problems, then stick with that. If you have heart problem and you are told to limit the amount of water or fluid you drink, stick with that. But if you don't have all these problems and you want to avoid having kidney stones, please increase the amount of water you drink or fluid you drink. I'm not saying you should drink all these carbonated drinks. No, I'm saying about water. You can have tea. It's counted. But avoid anything that would damage your kidney or give you kidney stones. It's not fun when you have kidney stones. It's painful. Drink more fluid to avoid all this. Moderate the amount of protein in your food. Even if you're a meat lover, that you love meat so much, moderate the amount of protein you take daily. That will help you a lot. Okay. Have a wonderful, wonderful day. A wonderful Sunday day. It's Sunday, but I decide to teach on this. As you know, I teach on mom's life. I talk about mom's life. I talk about God. I talk about nursing topics because I'm a nurse and I'm a mom. And I'm a Christian. So I talk about things relating to my life and lifestyle. Okay? I know what I do for a living. I'm a nurse. So you look after yourself, look after your kidneys, because when they fail, I'm sure you don't want to be on the dialysis. Avoid this kidney on the serious base. Avoid too much meat, too much salt. Drink plenty. Cut down too much spinach. Eat spinach, but everything should be in moderation, because too much of everything is bad and very little of it is bad too. So have a wonderful day. God bless you. Bye.